One. Hello, everybody. I am so pleased to introduce you to this amazing guest. Someone that I met in 2015 at the ShakeCon Ben Lynch's conference, and I saw your talk, and I just knew that this woman knows about helping women with hormones, and I've been working ever since. So Dr. Carrie Jones, you're normally introduced as a hormone guru. You are so into this whole connection between adrenal and thyroid issues. Mm-hmm. And then you are head medical director of Precision Analytical. So that's the company that has invented Dutch test, which is the test that everybody that I recommend is using, everybody worldwide who wants to look at hormones and energy in people. That's a test that everyone is using. And you're going to get into why that is and how that's implemented, because it's one of the tests that's actually available in Denmark and Scandinavia, everywhere. Mm-hmm. So you're a naturopathic physician. How did you get so interested in this whole topic of hormones?
I knew that I wanted to be a doctor from a very young age, since I was a little girl. And I thought I wanted to go into midwifery. I thought I wanted to deliver babies and do women's health that way, until I realized how much time it took to deliver babies. And I realized that my passion was more about the moms and less about the babies. And I would leave the babies to my friends who are into that. So when I went into school, I studied hormones, and I worked with all my mentors were hormone experts, and I did my residency in women's health and hormones. And then it grew from there, and it's just become a huge, huge passion of mine from the very beginning.
And right now, so that's actually kind of interesting, because it's a big issue for women to actually have babies. So we need you first. There's also this phase when women are in their 30s, 20s is where they actually burn out, tank hormones because of overdoing things, and because we want to be so great to everybody. So let's talk a little bit about that. So the traditional way of dealing with hormones is you go and get a test done. Maybe a gynecologist will look at you, maybe a doctor, and it will probably show up as you lack hormones. So personally, for me, what happened was I went to a hormone doctor, and my test showed you have no cortisol, no testosterone, no thyroid hormone, no estrogen, no progesterone, nothing.
Oh, no.
And he said, we'll just give you that. Travel with it. And I was, I was totally messed up. I couldn't stand up, and I was so tired after having a lot of stress around childhood, in my children's childhood, and all kinds of overworking issues. But I just knew there was more to it. So had you seen me back then, what would you have done to go upstream from there?
Absolutely. And it's so, when you said the doctor just wanted to give you a bag of, and send you on your way, it's usually the birth control pill, right? Usually they say, here, we'll just put you on the pill and you'll be fine. Everything will be fine. Or the other bad thing is when they say, oh, you have young children. It's to be expected. It's no wonder you're tired. Like, just embrace it. And I think, no, that's terrible. You can't say that. So what I do is, which is a lot of what you teach and what you teach your listeners, is all encompassing, right? I find out about your stress, and I find out about your sleep, and I find out about what you eat and how you digest. I find out, do you get gas and bloating? How do you handle your stress? Are you depressed? Do you have anxiety? And then I work backwards from there. So I do a lot with diet and nutrition. I do a lot with absorption. Sometimes women say, I'm eating really healthy, but it turns out they don't have stomach acid, or they have bugs in their gut and they're not absorbing their nutrients, so they can't get it in. I do a lot of adrenal and thyroid work with nutrients and herbs and stress relief. I teach about sleep. And so it's very all encompassing, right? It's very much a sort of everything at once, which some people say, oh, I can't that's overwhelming. I can't do everything at once. And I'm like, no, it's baby steps, but we have to lift you up all at once. Otherwise you kind of lift up like this, right? If I'm like, let's work the thyroid today, then you're like leaning this way, and let's work the adrenals today, then you lean that way. And so it is definitely, I do things to try to help bring you up all together. Yeah. As a body, as a person.
But if we kind of back it up a little bit, because I was quick to just talk about my symptoms, but prior to that, what was happening was weight issues. So no matter what I did, diet-wise and exercise-wise, nothing worked. I started waking up at night in a pile of sweat and having anxiety attacks. My hair was falling out. I had all this cellulite and cravings and exhaustion, and these issues, even facial hair and acne and all those things, these issues, can you explain why and how they are hormonal and how they link into the thyroid and adrenal issue?
Yes, and they're all linked all together. So as we know, the adrenal glands make cortisol, so that helps you with stress response. It helps you with blood sugar management, which people don't realize. It helps you with how you sleep, whether you wake up in the middle of the night, how you handle your anxiety. It has a lot to do with anxiety, and it plays off of your thyroid, and it plays off of your ovaries for women. And then of course we have the thyroid, which is, our master gland that sits there, and it has a lot to do with just hair and metabolism and digestion and skin health. And it helps control our ovaries, our reproductive tract. When do we ovulate? Do we get a period? How fertile are we? And then we have the ovaries, right? So that's sort of like our little sort of triangle of the endocrine system. So our ovaries make our estrogen, and they make our progesterone, and they make about 25% of our testosterone. And all those hormones have a lot to do with, do you get PMS, and do you feel happy and safe, and can you get pregnant, and what are your periods like, and how is your energy? And estrogen and progesterone, of course, affect cortisol, and they affect thyroid. And so when you have this endocrine system, this hormone system that's sort of out of balance, and they're either not communicating to each other, or they're trying to communicate, and there's things getting in the way, then you feel bad. You feel all the symptoms that you said you feel.
Yes, and indigestion as well.
Oh, yeah.
What is it that women do in their 30s that tank these hormones and give issues later? Because I know you're talking about, well, maybe time was on your side. So there's a lot of women doing CrossFit and spinning, marathon running, long distance running. It's almost becoming an addiction, and it works fine for a long time, and you feel great and victorious. But then what happens, and why is it important to catch this early?
Yeah. Well, for lack of a better term, essentially we burn out, right? Like we're basically burning the candle at both ends. And I agree with you 100%. I have so many patients that are addicted to their CrossFit, or they run marathons every weekend, or they're triathletes, or they go to their spin class at 5 a.m. every single morning, but yet they don't ever take time for themselves. They don't do any self-care. And so they're constantly lifting, running, pushing, burning, and then they go all day, and they have families often, and their jobs are stressful, and the family is a handful, and then by the end of the night, they've done nothing for themselves. They haven't relaxed or rested or healed, or their mind is spinning, so they're not sleeping that well. And when you don't sleep that well, you don't repair, and you don't maintain, and you don't heal. And so and myself included, I'm just as guilty. I had to learn the hard way. We just get ourselves stuck in this cycle. We just go, and we don't ever stop. And so if you can catch yourself, I often find myself telling women, like, don't go to CrossFit, or take some time off, or skip 2 days a week, or don't go to spinning every morning at 6 a.m. Maybe go 3 times a week, and then the other weeks do yoga, or go for a walk, or don't do anything. You have to give yourself a break every once in a while. You have to take care of yourself. And if you don't take care of yourself in your 30s, it doesn't get easier in your 40s, and it surely doesn't get easier in your 50s. and older.
What is it that's going on? Because, so from your perspective, this whole low thyroid,
Mm-hmm.
autoimmune kind of epidemic, where does that play in? And what's your advice for women in the 30s, in contrast to in their 40s, to kind of get an understanding of this whole thing? Personally, the only thing that I'm still taking is my desiccated thyroid, and I would like your opinion on that as well. But that was 3 questions in one. Just let me know if you forget one of them. I'll repeat.
So I was going to say, with going back to the autoimmune, as you know, is on the rise. And there's so many reasons for that. It's a combination, I think, of environment. I think of obviously genetics, of course, plays a role, but it's genetics isn't what pulls the trigger, right? Genetics loads the gun, but everything else, what we do, what we eat, what we come in contact with, that pulls the trigger. But so genetics, our environment, viruses, our digestion, the things they put in foods, the way we break foods down, it's called, the fancy term for it is molecular mimicry, where food gets through our intestinal tract and the immune system says, oh, that looks kind of like thyroid tissue, that like little piece of it. So it attacks the food and then accidentally attacks the thyroid tissue as well. And so this is why basic things like chewing, like chew your food, is so important. Or enzymes, or lemon water, or apple cider vinegar, things like that. So absolutely, this autoimmune is on the rise. And then on top of it, women get more autoimmune than men do. And our hormone imbalance, the need to optimize our hormones is definitely on the rise. And I absolutely think that's a product of, one, environment, two, diet, lifestyle, and just stress, the way that we live our lives. We're on all the time. We have social media all the time. We're not resting. We're running literally on the treadmill, or from place to place, or thing to thing all the time. And our body is not designed for the 21st century. It hasn't caught up yet. We need to rest and relax. You'll see, I'm sure you see this on social media. Women use the hashtag all the time, hustle. Like, I'm hustling. I'm a girl boss and I'm hustling. And I'm like, that's great. And I support you, but maybe don't hustle all the time. Maybe slow down sometimes, like take some time for yourself. But to answer your last question about desiccated thyroid, and just thyroid in general. So I find also that sometimes, these glands, our endocrine system, it can do a lot. I mean, the body is amazing, absolutely. But we have to give it the nutrients it needs. We have to give it the support it needs, and we have to, take care of it. And then if autoimmune gets in there as well, then it can be extra challenging if we aren't like extra diligent about our health. So I'm okay with desiccated thyroid. I give desiccated thyroid to my patients when they need it. Absolutely. Because if the autoimmune is progressed, or if the thyroid is progressed to a point where it's really struggling, it just can't put the hormone out anymore, then I'm okay with that.
And you were mentioning this molecular mimicking, which can happen with gluten.
Yep.
So that's an issue, and that's how it's linked to low thyroid, and it's often not diagnosed. Am I right about that?
Correct. Yeah. And gluten is probably the biggest one, the biggest food, but dairy can also be linked. Corn can also be linked. But what happens is when you don't chew your food, when you can't break it down, when you break down food, it should be broken down into what's called a single amino acid, meaning one amino acid. And when that crosses your intestinal barrier, it's okay. The body recognizes that as like, that one is okay. But if you don't break it down, then you might get a group. You might get 5 together, 10 together, and that's too big. And the body has to attack it to break it down. And then when it does that, the immune system gets involved. And then the immune system says, this looks real similar to something else, and this is bad. I think I'm going to better attack that other thing that looks real similar, like your thyroid gland. And so now your immune system that was attacking gluten, that came through too big, you didn't chew it, or you don't have the acid or the enzymes to break it down, now you get this, we call it molecular mimicry, where it looks like your tissue looks like pieces of gluten. And so every time you eat gluten, then every time you get little attacks against your thyroid tissue. And it go, the more you eat gluten, it just goes more and more and more, as you know.
Yeah, which is why because this is a normal thing, people saying, I'm 98% gluten-free.
Yeah.
Well, you can't be 98% pregnant. So it's kind of the same
thing. Yes.
So sensitive that I heard Tom O'Brien say that even if there's a crouton on your salad and you take it out, it will still have traces.
It could. Yep.
So when it's turned on, this whole autoimmune reaction, you say it's in the system, and that's what you need to go from. So we've got women who suffer from anxiety and sleep issues. Mm-hmm. They are completely drained. They cannot lose weight, or some of them can't lose weight. Some actually can't gain weight.
True.
But, and they have this belly fat, some of them. What do you suggest? Because when they go to their physician, they will be put on synthetic estrogen and maybe some progesterone if they're lucky. What would you do?
I go about it differently. And so, as you know, I do a little bit different testing than conventional doctors. So I look at all the hormones, like you said, estrogen, progesterone, testosterone, cortisol, but I also look at the pathways that they go down. So how does cortisol get broken down? Which pathway does progesterone prefer? How is your estrogen detoxified out of your body? Which pathway does testosterone go down? Because there's one pathway can cause acne and the other pathway doesn't. And so now that I know sort of where she's going, then I can affect those pathways and try to help bring her back into more like an optimal ratio of her hormones, right? I want her estrogen to be normal. I mean, it's supposed to be high at certain points, but if it's high all the time, then now she's moody and she has heavy periods and she gets weight gain, especially in the hips and the butt. If her cortisol is high all the time, she gets belly fat. That affects her blood sugar. That affects her insulin. We were talking earlier, acne. Women get we get that lovely chin hair, right? It's so not attractive. Absolutely, that the pathways of testosterone can affect that. And so instead of just doing synthetics, I'm first of all trying to figure out which pathway you're going down. And then why? Why are you going down this pathway? Is it inflammation? Is it stress? Is it gut bugs? Is your microbiome imbalanced? And that will affect these pathways. And then I from there.
And there's comments for you coming in here. Carrie is the best. Kisses from her power women in Denmark. It's from Nicole. And then there's a lot of thumbs up and hearts. And there's a question here about pathways, if you can explain that so that a 7-year-old can understand it.
Oh, yeah, absolutely. Okay, so let's start with estrogen. That's the easiest to understand. So you make or take an estrogen, and then it has to go somewhere. It has to do something. You need to break it down. So you take estrogen and it goes through a phase 1, a phase 2, and a phase 3 detoxification. So phase 1 and phase 2 primarily happen in the liver. And so what the body is doing is taking that estrogen and it's trying to get it to a point where then you can urinate it out or poop it out of the body to get rid of it in a healthy manner. But not everybody has a healthy pathway. So some people go down a pathway that might increase cancer risk. Some people go down a pathway that can cause things to grow. We call it proliferation. So they'll have fibroids, polyps, heavy periods, bigger breast tissue, which we don't want necessarily most of the time. And so what I try to do is look at those pathways, and then I know how to work with them to try to get you off the cancer pathway, to get you off the growth pathway and towards the healthier pathway. You've had guests on before talk about like methylation. So methylation and that enzyme COMT, COMT, is what helps you get from phase 1 into phase 2 estrogen. So if you don't methylate very well, if your enzyme COMT is slow, then you're going to have estrogen problems. If you have digestive issues, you're going to have phase 3 problems. You're not going to be able to get your estrogen out. So when I look at these pathways, I'm looking like, how do you get from the top all the way out the body, and where has it gone wrong? Because when it goes wrong, it turns and it causes symptoms.
And what's your best tips for estro detox? Because
I have so many.
yeah, and you constantly come up with new ones that I
I do. So phase 1 and phase 2 and phase 3 are all different. So phase 1 detoxification, you have 3 different pathways you can go down. So the 2 pathway, the 4 pathway, and the 16 pathway. So the 2 pathways, the pathway you want to go, that's the preferred healthier pathway. And that's things like the broccoli, the kale, the cauliflower family, we call them the brassica family foods, will help push the healthier pathway. And the ingredient in there is called indole 3-carbinol. And indole 3-carbinol breaks down into my favorite, which is DIM, diindole methane, which of course is a supplement, which is helpful. Other things that are quite helpful, which are broccoli sprouts. So the active ingredient in broccoli sprouts is sulforaphane, N-acetylcysteine, or which is NAC, or glutathione. Those help quite a bit for that phase 1 pathways. And the we call it the Apiaceae family. So that's your carrots, your dill, your parsley, your cilantro, your trying to think of other anise. Like those are all of your Apiaceae family, and they can be quite helpful too. So I tell people, like, eat raw carrots. Don't peel them. Just wash them.
And I want to tell you something about that, because I gave my detox participants, I've got 450 online right now going through a program, that tip. And the women who were struggling with these tender breasts and all these estrogen overload symptoms, within a couple of days it was gone. Just to, isn't that
so
amazing?
I love that. See, foods work.
So yeah, go on. Sorry for interrupting.
Yeah, no. So that's phase 1 detox. Now phase 2 detox is different. Those are things that will help improve methylation and COMT. And so believe it or not, well, your listeners might know this. Magnesium is a huge cofactor for COMT, and so many people are magnesium deficient. And so I tell men and women, take Epsom salt baths. Take a bath with the magnesium salts in it, because we're so deficient, and it'll relax you, and it will help your cortisol, and it will be self-care, and then you can help your COMT and work that way. And then phase 3 detox. Now, to get from phase 2 to phase 3 detox, inflammation is the big thing that will stop it. Right. So I tell people, if you're eating foods you shouldn't be eating, you shouldn't be eating them, but you eat them anyway, don't do that, especially if you have detoxification problems.
And which foods are they, for those who don't know?
Well, a lot of times people know what foods they shouldn't eat, right? People will say, every time I have milk, my stomach hurts. Every time, I have corn, my skin itches. Or when I have gluten, when I have too much bread, I feel bloated. I'm like, okay, those foods, probably the problem. Sugar, the excessive sugar. I'm not again, especially, I think dark chocolate is medicinal. I think dark chocolate is probably okay. But, we're eating lots of desserts and lots of candies, and, all that sugar can be inflammatory, not helpful to the body. So, but other inflammations. So environmental chemicals, if you've got, viruses, if you've got bacteria, if you've had a history of mono, which is from the Epstein-Barr virus, Lyme disease, mold exposure, all those things can, make your body chronically have to fight it. It's your immune system, your military, and your body is constantly on, and that can be upsetting. That can be pretty inflammatory, and that will slow down detoxification. But then, but the other things that can be helpful, one of which I already mentioned, is called sulforaphane. So that's in your broccoli sprouts. Curcumin is a really good one. Your resveratrol are in your red wine, although be careful with your red wine, but red grapes. And then when you move into your phase 3, that's the ability to get it out of your body. So making sure you're eating a lot of vegetables and fruit, fiber, things that bind up, because you're trying to get that estrogen out. Take your probiotics, your prebiotics, your fermented foods. Those are all quite helpful.
Awesome.
Yeah.
Before we get into the actual Dutch testing, what it does and how it works, are there any safe hormone replacement hormones that you would give? And is it anything that you can get a hand on without involving a gynecologist? Because I know you like the oral progesterone, right?
I do both oral and topical. So in the United States, progesterone is over the counter. You don't have to have a prescription. It's only to a certain dose. It's a very low dose, but they do make it. You can get oral. They're in like a liquid. They're in like liquid drops, not a pill per se. But I like the oral progesterone because it helps the most with anxiety and sleep. So topical progesterone that you rub on your skin is helpful, but when you swallow progesterone and it goes into your your liver, and then it breaks apart into all of these other we call them metabolites of progesterone, and many of them will cross into your brain and affect your GABA, which is your anti-anxiety brain hormone, your anti-anxiety neurotransmitter. So when women take oral progesterone, especially at night, they say, "Oh, I'm so much less anxious. I sleep so much better." I'm like, I know, because it crosses into your brain and it turns on your anti-anxiety neurotransmitter receptors, and women like that. So in the States, so progesterone's over the counter, DHEA is over the counter, and melatonin is over the counter. So we have those three hormones that we can get. And with DHEA, I absolutely use it. No, yep, for sure. But I'm very careful. My men dose and my girl dose or women dose are different. So men need a lot more than women do, but you still have to be careful. DHEA can increase estrogen in fat tissue. It's called aromatization.
Yes, and can you mention that just briefly, because there's a difference between men and women in that whole process as well,
Right.
testosterone, and we need it as women as well, right?
Yes, we absolutely do. And so the ability to take testosterone and make estrogen is called aromatization. It's an enzyme. The aromatase enzyme does it. So in men make all their testosterone, of course, in their testicles, but in their fat tissue and some of it in their muscles, they can take testosterone and then convert it into estrogen. So believe it or not, men need a little bit of estrogen, but not a lot of estrogen. Too much estrogen makes men moody and depressed, and they get belly fat and they grow breast tissue. They have erectile issues, right? So, but women need aromatization as well. In our ovaries, we aromatize testosterone into estrogen. That's how we women make estrogen, believe it or not. We make it from our testosterone. But we can aromatize a little bit as well in our fat tissue. It primarily happens in the ovaries. But to make one of our estrogens called E1 or estrone, that's made in our fat tissue. But DHEA, the hormone, the supplement, turns into something called androstenedione, and that aromatizes into estrogen. So I have seen men go on tons of DHEA and they'll say, "I don't understand. I'm gaining weight, or I'm getting belly fat and growing boobs." I'm like, "You're just converting it into estrogen."
Which is why I think it's so important to mention that you need to make sure that the hormone therapist that you're consulting has had actual testing with Dutch labs, Precision Analytical, and you, because I know for a fact in Scandinavia there are people who go on short courses and they hand out hormones to people via, for example, that hormone doctor that handed the package to me. And you can get into a lot of trouble by accumulating hormones, not knowing what you're dealing with. So,
right.
What's your best advice for women who has these issues? So weight that won't come off, exhaustion, anxiety, sleep issues, and how does the Dutch test come into that play?
So my best advice is to test one, to find a hormone practitioner who is trained and who understands not just the hormone, but what it does and where it goes. Because if you don't know the pathways, and like if your practitioner just said take this estrogen and you didn't know how you detoxified it, you could have felt better but increased your risk for cancer, which we don't want.
No.
For testosterone, your doctor could have given you testosterone, and if you went down the pathway that causes, acne, then you may have felt better, but your face would have not been happy. And so finding somebody who knows what they're doing is very important. But then the Dutch test is a test you do at home. It's super easy. It's an acronym. Dutch stands for Dried Urine Test for Comprehensive Hormones. We do not test for Dutch heritage. So we're a hormone test. And it's dried urine because they're pieces of paper that you will urinate on first thing in the morning, 2 hours later, around dinner, and before bed. So it's 4 times a day, 4 pieces of paper they're these little strips that you use. And so that's we get all the hormone information, all the cortisol information, and the pathways.
And then what happens after that? So what would a typical protocol be, also so that these women know what to ask their practitioner?
Mm-hmm.
Of course, it's important that they know a lot about methylation and both over and under methylation. But what's the procedure when this test result comes back? Because I've had that test done by someone who didn't know, and then you're actually sitting there with the test and you don't know what to do with it as well.
Right, which is why hopefully going back to trying to find a practitioner, not who just runs it, like, because a lot of people, any practitioner can run it, but who actually understands it, who's taken courses. So I was in Scandinavia. I taught 2-day courses. In fact, exactly a year ago, according to my Facebook timeline, it was exactly a year ago that I was in Copenhagen, in Helsinki, and Oslo, and Stockholm, teaching about the Dutch test. And so finding somebody who can actually walk you through all 6 pages of information, it's a lot of information. But on the other side is that Dutch test all our videos are free. And so if you're just listening and you want to understand hormones, you can go to dutchtest.com and watch all of our videos and webinars and blogs for free, and try to get an understanding yourself. Because if you are listening and you just understand the basics of estrogen and testosterone and cortisol, then it'll be that much more helpful to you when you're trying to fix your own health. And be an advocate for yourself, right? To request and to ask. And
amazing tip. What's your top tips for women to get out of this rut, and maybe even to prevent getting into these huge issues around perimenopause and menopause? So
right.
what's your go-to?
So I describe perimenopause as reverse puberty. So if you remember, ladies, going into puberty when you were a very young teenager, and it was chaotic and you were moody and it was emotional, and now perimenopause is the opposite. It's reverse puberty. So your cycles are changing, your symptoms are changing, you're probably moody. And so now is the time you have to be really, really focused on what you're eating, how you take care of yourself, how you're sleeping. Do not compromise your sleep. The big sleep researchers, the circadian rhythm researchers, won the Nobel Prize last year, for the year before. In the last 2 years, they won it, and to show like the importance of sleep and how it affects weight, and how it affects brain fog, how it affects your stress response. But I do have a lot of women do certain herbs. I'm a big believer in, certain herbs, like we call them adaptogens. So they're herbs that are good for the adrenal glands. They actually cross over and help the immune system. They help hormones. They help thyroid. And trying to just nourish your body with things like ashwagandha and rhodiola, 2 big ones. There's an Indian herb called shatavari. It's an Ayurvedic herb. Are you familiar with shatavari?
How do you spell it?
S-H-A-T shot A-V-A-R-I. Shatavari.
Wow, I've never heard of that.
So it's an Ayurvedic herb, and this is why I like it so much. The Latin name is Asparagus racemosus, but the tagline of this herb is, ready for this? The strength to handle 1,000 husbands. That. The strength to handle 1,000 husbands. So it's a good one. It's good for the adrenals. It's good for the ovaries. It's good for testosterone. It's just sort of a good female one that women tend to do pretty well on. That plus ashwagandha. And then of course, nutrients, making sure that you're digesting and absorbing, and and if you're depleted in things like magnesium or your B vitamins, if you need them, work with somebody, get your gut aligned, probiotics, prebiotics. I mean, I feel like I'm being very general, but I feel, with women, there's so much you can do at home. There's so much you can do that won't cost you very much money to get started. Like saying no, cutting back on your extreme exercise, go for walks, take an Epsom salt bath, make sure you get enough magnesium, making sure you're getting quality sleep, go to bed, get off your phone at night. I was just gonna say, wear your glasses. I wear my glasses every night.
Yeah.
And that's very inexpensive. And it works. It works when I don't wear my glasses, my red glasses like you have. My sleep is so much worse.
Yeah, it's blue light blockers. For those of you who hasn't seen these before, my son is a DJ, so he's also producing at night, and he's always using these, and these make him sleepy, so he can't stay up after 10 because he stays within the circadian rhythm. So that's so awesome.
How does he DJs at night?
Well, when he's producing, when the sun goes down, he puts these on.
Yeah.
And then that tells him, okay, 10 o'clock, I'm tired, I gotta go to bed. But if he doesn't wear these, he can stay up and disturb his whole hormonal system. So
it's so true, right? And we all do it. We all lay in bed and flip through our phone, or watch TV and are on our phones or our computers, our tablets, and then we're wired. I mean, our brain sees the brain sees the light that our phones emit, and it goes, oh, it's bright. We call it blue light, and it's the blue light frequency. That's like sunshine. Right? It's like a sunny day, and so then it must not be bedtime. I must be wrong. And so then melatonin doesn't come out, and melatonin is a huge antioxidant. And ladies, melatonin is a big one for setting our reproductive cycle. So if you have irregular cycles, if you're trying to get pregnant, if you find that you're very symptomatic every cycle, but your sleep is not good, if you get quality sleep and your natural melatonin comes out in a healthy way, it helps your circadian rhythm, but it helps your reproductive rhythm. And it helps your feeding rhythm, when you eat, how you eat, feeling hungry.
That is so important too. Menopause and this whole disaster zone, can it be prevented, and can you lose that fat and that thigh stuff, the stuff the stuff that just blurps out over the jeans? I don't know the word for it.
I like it. No, I like it. I get it.
From your perspective.
Yes. So it is tough. I will say it is definitely tough. So women, we gain weight in menopause because the body can make estrogen out of it. So it's a very, very old built-in mechanism, thank you, that we have as humans, as women, that when I am in charge of the female body, I will get rid of. But it's because thousands of years ago, was women, if they lived old enough to hit menopause, but if they went through menopause, then they needed estrogen to protect their brains and their bones and their skin and their heart. Estrogen is very protective. We think of estrogen as breast cancer. Yes, but it's also very helpful for so much of our system. So the body would make us gain, weight to make estrogen. So, and in this day and age, women have so much estrogen, and we have so much estrogen chemicals in our system. So I tell women, okay, if you've always been doing a certain thing, change it up. Make sure you're sleeping, change your exercise patterns, your exercise habits. If you're a chronic crossfitter and spinner, go the other way. Throw some gentle stuff in there. If you've never exercised in your life, time to start exercising. Diet, make sure your diet is much better. Work with somebody who can help with hormone balance. When women lose estrogen as we get older, that weight goes on to make estrogen. So if we can help our thyroid and our adrenals and our declining ovaries feel better, then we don't get the weight. It will, what did you say? Blurb. It'll not blurp out. I love that.
Blurp out. Someone's asking, would ligma, have you ever heard of that? Ligma, help with menopause? I've never heard of ligma.
I've never heard of that. No, I don't know ligma.
Can you repeat the herbs again? So it was ashwagandha. Ashwagandha, some people have negative reactions.
Yes. Yeah. And this is why, like, we keep saying that's why you should work with somebody, because even ashwagandha was one. Rhodiola is another good one. Now there's several. This is a family of herbs called adaptogens. But rhodiola can be very stimulating for some people, and it can be very drying. So if you have dry eyes already, it may not be the right herb for you. And then the other is that Indian herb, shatavari, so we all want the strength to handle 1,000 husbands. But even still, some women already have high testosterone. Think of your PCOS, your PCOS women. They probably don't need it. That's probably not what they need, is more testosterone. And I have seen shatavari worsen women with too much estrogen. Not always, but I have seen it. And so again, it's just working with somebody who can test you and then find the right herb for you with what you're going through.
Yeah, no one size fits
ever. All. Never, ever. Not even magnesium. For as many people as depleted in magnesium, absolutely. If you take too much magnesium, you will have diarrhea.
Yeah, that's true.
Perfect.
Plus, when you start taking magnesium, you might get worse until it gets better. So patience with that as well. Yep. One last thing, because then I want you to tell people where they can get hold of you and read more about you and follow your blog and your website. But there's a connection between cholesterol, which is something that everyone's afraid of, and thyroid that I think is important that you mention.
Well, and even just hormones in general, I want to first talk about hormones. So cholesterol is the backbone to all of your male and female hormones. So your cortisol, your estrogen, your progesterone, your testosterone, your DHEA, cortisol is the backbone to all of it. So if your cholesterol is too low, if you are on some kind of medication to really lower your cholesterol, I have seen it on lab work where your male and female hormones are quite low. And so to be very careful, if you don't make cholesterol or you're on a blocker, you may not make very healthy levels of your hormones either. So you have to be careful there. Now, thyroid is different. So thyroid hormone, cholesterol is very involved in making the hormone TSH. However, your T4 and your T3 hormones are a little different. That uses your amino acid tyrosine, and it uses the nutrient iodine, or I think you say it differently, iodine. Do you say iodine?
No, I do say iodine. Maybe I'm
listening to the Americans. Right. So it is definitely more involved when it comes to thyroid with cholesterol.
Do you take people off cholesterol medication?
In the United States, I have the ability that I can as a doctor. Usually what I will do is I will call the doctor that prescribed the cholesterol blocking medication and say, hey, look, their hormones are very, very low. Can we reduce the dose, or can we find other ways to work on their cholesterol? And also keep in mind, cholesterol is the, how would I say this? The cholesterol are particles, right? And so if your cholesterol is high, why is it high? Is it high because of genetics? Is it high because of inflammation, right? When you have inflammation, cholesterol can go up. Why is it causing it to be high? And then which one of your cholesterols is high? And is your cholesterol big and fluffy, or is it small and problematic? And so when you do cholesterol testing, I often do bigger, more advanced panels because I want to see, yes, you have high cholesterol, but is it high in the good stuff? And or is it high in the bad stuff? And how many particles do you actually have? And so it's more complicated, I think, than people. Not complicated. It's more. It's not all bad. Cholesterol is not all bad.
Someone's asking, my cholesterol is elevated after menopause. Is there a connection?
It could be, and we see this all the time, again, because cholesterol is the backbone to hormones. And so it could definitely be, if you go into menopause, you lose your hormones, and so your cholesterol goes up to try to counter it, to try to help. But it can also be inflammation. If you go into menopause, if you do have quite a bit of inflammation, it can go up for that reason as well.
You are so amazing, and I'm so happy you showed up. I know you have a super busy schedule. It's been taking a couple of months to get you on.
So. I know. I'm so glad it worked out, and I'm home. I'm not traveling.
Yeah, I know. I'm so happy. So where do we get a hold on you and read more and get access to all these amazing free videos that you've got and get our Dutch test done?
Absolutely. So you can go directly to on the website dutchtest.com. And then for me, finding me, I'm definitely most active on Instagram. My Instagram name is at dr.carriejones. And everything I have on there is education. All of my posts are about hormones, hormone education. I do a lot of 101. Explaining the basics. What is a hormone? What is estrogen? Where does estrogen go? How do I make testosterone? And I do mostly women's health, but I do quite a bit of men's health as well, because we can't forget our men.
Exactly. Yeah, I recommend following that Instagram. That's awesome as well. Thank you so much. And I know you've got a meeting coming, so
yes, it's perfect.
I'll post all the links, and I'll write them in the thread here afterwards for everyone.
Perfect. Thank you. Bye-bye.